Shin splints are a very common injury that we see in the athletic population, in particular runners. They typically complain of pain along the front part of the lower leg and the area below the knee and above the ankle. It's often caused by overuse. We see it often in runners if they are increasing the amount of miles that they run, frequency that they run, changing the types of surface that they run on as well. The best way to find out if you have shin splints is to see your physician. And after a thorough evaluation of both the muscles and bones in the lower leg area, oftentimes we'll take a look at an x-ray to see if there's something more serious than shin splints, like a stress fracture or a fracture to the bone. In rare cases, there can be other further evaluations like a bone scan or an MRI. The easiest way to treat a shin splint is to cut down on that overuse activity that you're doing. To help with the discomfort, you can ice the area of the leg that's sore. Sometimes an anti-inflammatory can help. Also, changing the type of shoes that you wear, sometimes getting extra support in the shoes can help. Other activities such as lower impact cardio exercises like swimming, biking can help as well. The recovery time for shin splints really varies. Sometimes if you shut things down and rest, you can recover from them within a couple of weeks. Other times they can take up to a month, sometimes 4 to 6 weeks, sometimes even longer to recover from. The most important part is to get appropriate rest and then change whatever type of training you're doing to put less stress on your shin. Things like physical therapy and some home therapy exercises can often help to strengthen up the muscles of the legs. And then also when you start having pain, you need to realize that and back off. If the pain starts to get worse during your run, well, that's a sign that you probably should cut down on your running and back off for several days to maybe a week to recover from this injury. We can see worse injuries such as fractures if you continue to persistently run through the pain, and other types of injuries as well, like compartment syndrome. Those type of things can also be presenting with similar symptoms of shin splints, in particular that lower leg pain. If you start noticing pain in a new location, that doesn't go away with rest. To either cut back on the activity that you're doing, and if that doesn't work, coming out to see a sports medicine physician to get further evaluated.